you so much. Again, so sorry for the delay, but we're here now. So this is supporting independence. This is our supporting our sorry of our Empower Caregiver series. So at any point, if you have any questions, please just come off mute. I'm happy to take questions, as they come up. But let's start.
Sorry,
All
Mary Grace,
right.
we can't
So
really hear you
learning
very well.
object.
I'm sorry.
Oh, you can't hear me very well?
It's kind of going in and out.
Okay. I'm gonna keep going. Hopefully it's okay. If not, I can move. Or is it still bad?
I can hear you now. Fine. Yeah.
Okay. All right. I'm so sorry, everyone. All right. So our learning objectives are really going to be able to explain changes in independence that happen, especially for people who have Alzheimer's or another form of dementia. We're going to talk about a four-step process for helping with care activities, and we're going to go into bathing, toileting, dressing, and eating. We're going to list tips to help make activities meaningful, and then identify to know what is the right amount of support, as well as how dementia affects safety. So most people living with dementia, they want to be independent for as long as possible. And I don't want to say that's people with dementia. I mean, that's anyone, right? You want to stay independent and you want to be able to take care of yourself in ways that make sense. So as your caregiver, or as a caregiver, sorry, you likely might know that person best, the person who you're caring for. So what we want you to know is that you will need to figure out and kind of be a detective and figure out what are the things that can help that person stay as independent as possible. And you will know this by understanding their likes, their dislikes, their preferences. And we call this person-centered care. You want to try to include the person with dementia about their support. This means you want to talk to them about what do you want, this to look like? Do you want me to come in and help you right away? Or do you want to kind of figure it out and I can give you a couple of seconds or a couple of minutes to do so? Being a part of that conversation can allow for them to be a part of that process as much as possible and to feel like they're, giving their input when it comes to aging. All right, so true or false? All people living with dementia need the same amount of support. What do we think? Yeah, I see Heather said, I think she said false. That is correct. Every person living with dementia are going to have different strengths and abilities. They're going to have different preferences, like we said, likes or dislikes. And as a caregiver, it's your, role to be able to know that person well to provide the correct amount of support. So again, each person living with dementia is going to be unique. And we know that dementia is a continuum, right? It will go through ebbs and flows, but it will progress. And so as somebody goes through the disease, their needs and their independence is going to change. And so how Alzheimer's can affect independence, how it affects independence is because the disease causes brain damage to the cells. And so people are going to then struggle with memory, with some of the executive functioning skills, and even sometimes some personality changes may occur. And they make it very hard for the person with dementia to follow instructions, to move from one activity to the next, steps to especially, if it was familiar once, it can no longer be familiar later on as a person progresses. So again, everyone's journey is going to be unique as the person changes as well. So how can caregivers help maintain or maximize their independence? So the first one is to encourage independence. Focus on what they can do versus what they can't. And I know that sounds pretty self-explanatory, but sometimes, it's easy to harp on the things that people can't do, but try to elevate that and instead flip it and think of what can they do and to be very thankful for the things that they can still do. Do tasks with the person instead of for them, and then connect with them instead of correcting them. And you're going to hear this a little bit, moving forward as well. As much as you can try not to correct someone, do so. Because really you need to think, is it worth correcting them in this moment and potentially having some pushback to that versus just, oh, the napkins don't need to be folded correctly. It's okay if there's a fork in the spoon drawer, things like that. So assess and modify. You need to adjust your approach as a person's abilities change. And like we said, dementia is a continuum. Their abilities will change as time progresses. And so you need to be flexible with that as too. If they change, you will need to change as well and adjust your approach. As the disease progresses, breaking things down into smaller tasks is never a bad thing. The smaller the steps, the more likely someone is able to complete them and feel accomplished in doing so. And also note that they might need more time to do each step, and that's okay. And they might not finish all of them, but it's really being, again, able to meet them where they're at. Say, I would love if you could put away the silverware, and maybe they can get all of the forks done, and then that's it. But that's still progression and that's still an accomplishment. So again, breaking things into smaller steps, giving them time to do so, and knowing that it might not be completed, but that's okay. So again, person-centered support essentially just means being able to use the person's likes, dislikes, and preferences to know the best way you can support them. In the early stages of Alzheimer's, they tend to be pretty independent. Even at the very beginning, they might be completely independent. It just might be affecting more of their memories or their thoughts. But as it goes on, things can change. So again, they will need more support with activities, depending on what they may be. And so again, just adjust your support as needed. And sometimes it's a good thing to assess where they might be. Let's hear from a caregiver. Let me know if you're having trouble hearing it, but I think you should.
So with mom, examples about around mealtime and cooking, she was willing to allow for my sister and I to prepare meals. And what we would do is have her maybe break apart celery or chop up some bigger size vegetables if we were doing a soup or something, and still incorporate her in those activities. As again, the condition continued to progress, we then would just manage the full preparation ourselves, but supported her process in terms of the eating.
All right, so we're going to talk about a four-way approach to supporting personal care activities, and we're going to go through each step and look at what that might, by depending on the task. So first one is planning your approach. Second is simplifying the process. Third, create the right environment. And fourth, identifying health issues. All right, so planning your approach. Again, use person-centered care. Know them, think about their likes, their dislikes, and their abilities. With each activity, this may obviously sound very obvious, but make sure you treat that person with dignity and respect. Give them choices if you can. And you know that sometimes, like I said, people, as the progresses, those choices might change. But we always tell people, give them a choice or the illusion of a choice as long as you can. So at the beginning, it might say, all right, grandma, do you want eggs or do you want toast for breakfast? And then later on, maybe they can't make that decision. So instead, you're going to change that choice to be, okay, do you want butter or do you want peanut butter on your toast? So do you see how maybe the choices aren't going to be as large as they once were when they were more in the early stages, but you're still giving them that illusion of choice as time progresses. And again, there's a lot that can be done with just giving people time. I'm a very fast-paced person. I, always want to do everything quickly. And I think some people get frustrated when, others aren't doing things as fast as they would like them to. But here you need to note that that's normal and that's going to happen. And so slow down and let them get that time to do something themselves, even if it might take them an hour to put down the silverware, or put away the silverware. That's okay. But give them that time to do so they can get to the end and feel accomplished. Two, simplify the process. Break activities down into smaller steps. Focus on one step at a time. Again, maybe at first you could say, Mom, let's put away the silverware. But as progress, you might need to break that down. Hey, Mom, let's organize the forks, together right now. Okay, now that the forks are all in one, let's put the forks from that pile into the drawer. You might need to break it down into different steps as things progress. Take out extra questions or things that are necessary. There's sometimes in instructions or in life, they're fluff. right? There's extra things in it. Take some of those away to expedite that process and to make things more streamlined and easier to understand. Another thing to know is sometimes it might have to be a yes or no question. So saying red, blue could be a little overwhelming. You might need to say red, yes, no. That's still, again, options and choices, but it's taking out some of that unnecessary pieces. And give simple instructions and encouragement to help them feel successful. So as they go, encourage them. That's great. Great work. I appreciate your help. The more that you can encourage people along the way, that will help them feel more successful as they do them. Create the right environment. This could be, people with Alzheimer's, it's very easy to get overwhelmed. And so correct by making sure that things are comfortable, that it's free of distraction. Maybe that might mean turning the TV down a little bit or turning the TV off completely. That could also be, there's a lot of noise going on because there's children all over and people are getting a little overwhelmed. Moving them to a place that they're a little bit more comfortable. Free of distractions is a great one. So keep the music low, keep it light. Doesn't mean you can't have music, but don't have it like overwhelming because that can make it very difficult for someone with Alzheimer's or dementia to get a sense of where they are in their surroundings. And all remove trip hazards, and that's something easy. Maybe get rid of some rugs if the ends of the rugs are kind of sticking up and people trip on them. Make sure that there's nothing going away from the path to the bathroom. These are all things that people can think of. And air and always allow people. So as much as you can, put a barrier there. That could even just be a towel. It could be a curtain. But give people privacy as much as possible because creating that comfortable environment will go a long way. Identify health issues. This is the last one. This is really big because health issues definitely can exacerbate somebody's responses or someone's dementia-related behaviors. So is the person uncomfortable? Are they sitting in a weird position? Are they unable to move and they're not, their back is hurting? Check to see if they have skin conditions or other types of infections, eczema, cuts, bruises, scrapes. Talk to a doctor if you've noticed any changes in a person's health. The doctor is going to be one of your best friends because they can tell you, are you overthinking things or is it definitely something that could be impacting their memory? And make sure that all doctors and nurses know that the person is living with dementia and to tell them that they're taking medication. This is particularly if you go to an urgent care or somebody make sure that you know for past dementia and that the medications are around because medications they can interact with each other, right? Medications can, especially a new medication, it could cause a reaction. So make sure that your doctors all know that they have dementia and that they have different medications. All right, so now we're going to apply the process. We're going to go just due to time, skip through some of the scenarios, but we're going to talk about what this might look like. So let's go first into bathing. So planning your approach when it comes to bathing. This is again, knowing the person-centered care. Do they prefer bath or shower? When do they normally bathe? During the day, at night, right before bed? And again, do not rush them. Allow them time to bathe. Simplify the process. Use your words and actions to show how to wash your body. So maybe you have to say, hey, why don't you take the towel, or the loofah, and put spread the body wash around. Sometimes you might have to show somebody how to do things before they'll start to do it. And so using actions helps, but also sometimes maybe using some verbal cues. All right, mom, now you need to pick up the soap and we'll put the soap around you. Or maybe now you're going to pick up the shampoo and put that in your hair. Verbal cues can go a long way. Again, verbal cues also encourages independence. You're not doing it, not saying, "All right, give me the soap, I'm gonna wash you right now." But you're saying, how about you try to do it yourself? I'm going to guide you through that process, but you might need help when needed. So for example, you could say, oh, let's put some shampoo in your hair, but then you notice they're really having some trouble. So you can say, why don't I help you with that? Why don't we make sure it's all out of your hair. Things like that, that's allowing them to still be independent, but stepping in when you need to. Focus on one body part at a time. All right, let's focus on right now just our hands. And then we're going to move to our right arm and then our left arm. I know it sounds very slow, but sometimes that kind of process can make it less overwhelming for somebody. And again, do not rush. Create the right environment. Provide a quiet, relaxing, and warm space. Respect their privacy as much as you can. Put some type of a towel, close the door, things like that. Maybe you don't trust them to be in a lot that put a door there so they feel like they can close it and that they have some of that privacy. And then make sure the room temperature is not too hot or too cold. Also, make sure that the water is not too hot or too cold. Sometimes people, they might not be able to tell you when things aren't okay or not up to their par. And so that's again where you need to use their likes and dislikes to know, do they like a warm shower? Do they like a really steamy hot shower? Some of this is very helpful. And identify health issues. Consider if a person's physical or medical issues could affect the bathing process. If they bathe and they have a really bad bruise on their back, that could affect their bathing, right? They might not want to sit in that position or be in that position. So you might want to think of some of those aspects as well. Or if they have a rash or cut, that could affect, the process. And then find out if they have any pain or trouble moving around. So we're going to listen to hear from a caregiver.
I always knew that Kathleen doesn't like a cold bathroom. Her ability task like our sin and bathroom warm for her. Started the shower at the risk of wasting a little bit of hot water, such that I could tell her, "Sweetheart, I got the bathroom nice and warm, all steamy and warm for you. Come on in." And of course, that led to lots of laughs when she walked in and saw my glasses all steamed up. She thought that was just the funniest thing, but she was grateful that I had cared enough to get the bathroom warm for her. And then initially, of course, she didn't want any help, in the shower. That's a very personal thing, and I respected that, but nevertheless, I stayed in the bathroom, just making sure that she was okay. And then gradually, I said, could I help you with the shampoo there? That knew taking care of hair. She allowed me to help to make sure that we got it out of her hair. And then, of course, the luxury of nice warm towels waiting for her as she stepped out of the shower. I really appreciated that. And my goodness, what a great, somewhat intimate connection that was, to be able to help my wife in the shower. I'm sorry that I had
that
to
audio
do it,
pretty bad?
but I'm glad that I had the opportunity to do it.
Do you want here? Let me try to go to a different spot. Give me one moment. Okay. I'm gonna see if this is any better. Should I replay that? Okay, we'll keep going. All right. Thank you everyone for bearing with me on some of these technical issues. All right, we're gonna skip putting it into practice just because of time, but we're gonna go right into our next place, which is eating. All right, so again, plan your approach. Think about what foods the person likes and how they like them cooked. Again, you're going to see a video on this, but if there's flavors that people enjoy, you can still incorporate that even if it's going to be into softer foods, right? Be flexible with mealtime. If the person is upset or refuses to eat, do not force them to eat. Wait and offer them food when they are ready. Again, it doesn't matter if they eat at breakfast at 10 a.m., if they eat breakfast at 6 a.m., if they eat dinner at 2 p.m. That kind of stuff, it doesn't matter. And it's, one of those things you just have to think, is it worth getting upset on, or we're going to let them eat dinner at 3 p.m. That's okay. Look for ways to include the person in making the meal, setting the table, or filling their own plate. So look for ways they can be included. Maybe they can't put the food on their plate, but they can still feed themselves. Okay, well then let them feed themselves. Maybe they get to a point where they can't feed themselves anymore, but they can still at least join the table and be a part of the conversation. You want to think of ways that you can include them, even if it might not look like the way it used to be. Simplify the process. Offer only a couple of food options. Again, give people choices or the illusion of choices. Don't just say, I want you to eat peanut butter and jelly, so you're going to eat that. But the options might change. Like I said with the toast, the options could change. The way you provide the options could change. But again, as much as you can give people options, the better. Encourage them with simple instructions. All right, mom, let's get the fork out. Now, take a piece of food on the fork. Now put that fork to your mouth. Again, that might sound trivial, but to some people, they need some of those added instructions in order to be successful when it comes to eating. Make food easy to pick up. That could be you cutting the food you can pre-cut food for them. That could also be using special forks or knives that make it easier for people to actually be able to ingest the food and eat. Create the right environment. This is where sometimes it might make sense to turn the TV down or to turn the music down or change the music from maybe some more upbeat stuff to more ambiance type of music, because that limits distractions. If there's a lot of stuff going on, sometimes that doesn't encourage eating because they're distracted or overwhelmed. I already said this one. Play music. If you play music, make sure it's soft and relaxing and you keep the volume low, and make sure there's good lighting. If people can't see the food that they're eating, sometimes they won't want to eat. So make sure it's lit and they can see them, if they can feed themselves, they can see actually the food and are able to safely be able to ingest it. Identify health issues. Watch for any changes in the person's ability to chew or swallow, especially if they wear dentures. Make sure they're fitting correctly. Watch for mouth sores, swollen gums, or loose teeth. These are all physical ailments that can cause a lot of pain that can then cause a reaction. And then tell your doctor if the person doesn't seem to be eating or drinking. That's something that doctors definitely should be alerted on, because that could mean a change in their health.
We realized that she was no longer maybe able to chew things like meats, chicken. And so we started, not by, I guess, a conscious decision, but just because of mom showing us what she could and could not do with regards to eating, doing more of a vegetarian diet for her, and definitely things where we would use softer foods as a disease progressed. So we were able to incorporate different flavors and meals that were still very much a part of the cuisine that she was used to, and the sazon flavors that were familiar to her, with things like eggplant, which was something that maybe she never necessarily had as a child or as an adult, but we were able to season it to her liking, and that's something that we kept kind of on a regular part of our meal planning, to make sure that she still had the nutrients that she needed, but also keeping the flavors that she knew and liked.
All right, so we're going to move on to our next topic. Using the toilet. Again, plan your approach. You may need to remind the person to use the bathroom every few hours, especially when it comes to dementia or Alzheimer's. Sometimes they forget, and that's okay, that happens. And so you might need to have some more verbal cues. Consider when accidents can happen and how you can avoid them. If you're traveling or there'll be an extended period of time where they can't use the bathroom, you might need to plan accordingly. Watch for body language that tells you a person may need to use the bathroom and encourage them to go. If they start moving around a little bit, or maybe they're kind of clutching their stomach and they're not hungry, you can use some of those cues to determine, oh, maybe they have to go to the bathroom. I should remind them to do so. And again, think about using protective underwear or pads. Sometimes there are accidents that happen, and it might be, a time where that could be a good option to have. Simplify the process. Be sure clothing is easy to take off. This includes buttons and zippers. Sometimes as people get older, those get harder to do. And so accidents are happening. And it's not because they aren't trying to go to the bathroom. It's because when they get to the bathroom, they're unable to take their clothes off quickly. So if, make sure that there are no buttons, zippers, clasps, things like that that can impede in someone's ability to go. Make sure the toilet seat is in the right position. This could, if you see in the picture, sometimes there are toilet seats that are a little bit raised that might be appropriate to use. Think about if those things are necessary and helping somebody. And make sure that they have a portable bedside toilet or a raised toilet seat, like I just said, if they're starting to have trouble. Make it as easy as possible for them. Create the right environment. Make sure the bathroom's easy for the person to find and use. There's a story once of an individual whose loved one was having trouble with the bathroom, and after having conversation, she realized he didn't know what door it was. So she ended up buying a sign on all of the bathrooms that clearly showed that this was a bathroom, and sometimes that's what needs to happen. And then again, make sure that the space is kept private, because this really will help the person feel safe. Identify health issues. Determine if the person has a bowel or bladder problem, such as constipation or incontinence. UTIs are very common among older adults, especially with dementia, because they forget to go to the bathroom. And so they have a urinary tract infection. Think of some of these things that could be occurring, because that's a health issue that definitely should be talked to with the doctor.
With toileting, as my mother's needs change, she liked doing it less and less, but I had to do things to sort of entice her to do it. I would say, well, Mother, as soon as you use the toilet, then we'll have our lunch, or as soon as you use the toilet, we'll go ahead and get dressed. I had to sort of bring in other factors to sort of entice her to do her toilet, and it wasn't something she particularly enjoyed, particularly as she lost her ability to walk. But this is the way that I would sort of entice her into the process and to help her understand that there was something on the other side of toileting.
All right, and now we're going to go to the last section, which is dressing. Number one, planning your approach. Allow for enough time. Do not rush, especially when it comes to dressing, because this is something I think that naturally becomes just a little bit longer as people get older and they lose the ability to dress or undress themselves. Respect their personal style, including, again, their likes and their dislikes. If they don't really like wearing colors and patterns, then don't dress them in colors and patterns if they can't do so themselves. Make sure that you're really keeping to what makes them comfortable and what makes them, feel good. And then see how much help they need. They may need help choosing the whole outfit, or they might need just help with one piece. This again goes into the illusion of choice, and also how that choice may change as you go. So at the beginning, it might be, okay, Mom, do you want a dress or do you want a t-shirt and pants? But then that might change later on, and it might be, okay, I already have your whole outfit checked, but do you want the red shirt or the blue shirt? Again, it's still giving them that choice, but it's changing how much of a choice and how difficult that decision could be as they, progress. Any dirty clothes as soon as possible, remove them from the area. Sometimes people what's dirty and what's not, so it's good to make sure that they're separated, they don't get confused with each other. Offer 2 options so they can choose one. Again, as many times as you can offer options, the better. People really like to have the illusion of choice because it allows them to feel independent. Lay out clothing in the order it should be on. This is something that, seems silly, but it does help if you put the underwear and, on top, and then maybe the pants, and then the shirt, and then the socks, and then the shoes, versus putting the shoes on top, and they could get confused, right? Of what order am I supposed to be on? So lay it in the order that you want them to put it on. And you might need to use just gentle physical prompts to help them dress themselves. For example, all right, let's put your right arm in. Let's put your left arm in. Things like that. Create the right environment. Definitely make sure they're dressing in a safe area, that they're not exposed to windows or to other people. Help them feel comfortable. For example, put out a towel, put out, some type of sheet so they feel like their privacy is still there and they're not losing some of that comfortability or that dignity.
My approach to getting my mother dressed as her needs changed and through the process was to keep her involved in what it is that she would put on. My mother was always somewhat of a vain person and she liked really looking nice. So I would try to buy her outfits that she really liked, that really appealed to her. I would try to buy colors that I knew that she liked. When it was time to get dressed, I would present several outfits to her and let her select what it is that she wanted to wear that day. And just to keep her motivated and as a part of the process, to keep her interacting with me. She really liked looking nice. I liked doing things like keeping her hair done and whatever. And she seemed to appreciate that part of my effort to involve her in the process.
We're gonna skip this. All right. So now we're going to talk about taking parts in meaningful activities. Again, when it comes to somebody with dementia, sometimes some of their behaviors are due to boredom or due to not feeling like they're doing something that has a meaning to it. And so we're going to talk a bit about what that might look like. Again, I keep going back to person-centered care, and I know that it might sound redundant, but really, you need to use a person's skills and abilities because that will help you be the most successful when it comes to having them keep their independence as long as possible. So do activities that they're good at and they've always enjoyed. Don't have them do something that they've hated. So for example, I don't like cooking. I'm fine with cleaning. So when it comes to maybe finding something for me to do, I wouldn't really like to do a chore that comes with cooking, but I will put away silverware and I will clean a pan all day. So again, using what you know can really help you navigate as someone ages. And also, you need to make sure that the changes in activity matched what the person can do. So again, their abilities are going to change as the disease progresses. And so what you ask them to do could change. It could start with, I'm going to have you set the whole table. And then it could become, I'm just going to have you put out the napkins. Or it could become, I'm going to have you maybe take out the forks and do that first. It's going to have to get segmented as people's abilities change. So what they do, make sure they're still doing what they like, but you're triaging it in an easier way. So again, pay attention to what they like and don't like. Definitely make sure that you can note if they seem happy, anxious, or bothered, or irritated. If they're seeming irritated, change it. Even if they maybe loved to do that every day, but today they seem very irritated doing it. Everyone's going to have good or bad days when it comes to this disease. So maybe today this work's not great. Let's try again tomorrow. So for example, some people enjoy watching sports while other people might think it's too noisy or fast paced. Help start the activity. Sometimes you might need to fold the first towel or dry the first dish. Again, when you can use verbal or physical cues, that can help a lot with just telling someone or showing someone what they should be doing. Talk them through the steps as you do. Again, this might sound really mundane, but break it down into easy steps. All right, first thing, we're going to fold the towel in half. Hot dog, long ways. And then we're going to fold it again in half. These are all instructions you might have to do the first few times, but then hopefully they'll be able to catch on. Again, most people living with dementia, they can still do things if they just have the right amount of support. So just because you see they're struggling to fold a napkin doesn't mean you take all the napkins away and they're done folding napkins. That just might mean A, either the napkins you're going to be okay with them not being folded right, or B, you're going to have to break it down into smaller steps. Focus on the activity, not result. This is something where you just have to learn to let it go. Remember, sometimes if it's not done right, that's okay. It's not the end of the day. Again, the towels aren't folded right, or if the forks are in the spoon drawer. You just need to remember that the result might not be the end all be all. It's as long as they're busy and they're doing an activity and they're seeming happy. What matters is that they feel useful and that you're able to spend time together. Break activities into easy to follow steps. Keep it simple. Focus on one task at a time. Too many directions can be overwhelming, so give them a direction, wait for them to follow that direction before doing another. Don't just rattle off 10 different steps. Let's start with step 1. Wait until step 1's done. Then step 2. Again, things are going to take a long time or a little bit longer of a time, but that's okay. Offer help if the person is having trouble with something, but again, don't just take it away from them if you notice it's trouble, they're having trouble. Offer to see if they need help first, and then, you can continue on if needed. Talk to the person. I think sometimes we like to make decisions for people, from stages of dementia, talk to them because they're still able to comprehend that you are speaking to them and that you're engaged when you're cooking, or you're full on, or you're cooking. It allows them to feel like they're part of the process and try again later. If something's not working, it just might be the wrong time of day. They might not be in the right mood, or the activity might be too hard. And that's okay. You can stop what you're doing and try it again later. You never need to force someone to finish something or force something to be perfect, because sometimes it's just one of those days. We all have those days. And you may need to make changes to the activity or try it again another time. Don't just, give in and say, well, mom messed up all of the towels this morning, so we're never going to have her do towels again. It could just be a bad day. Try it again later. The right amount of support. So again, we keep talking about the right amount of support. What does that look like? So now this segment is going to help us try to understand what that might be. Find a balance. So too little support can definitely make someone feel frustrated and give up. And too much support can make the person not want to be a part of something or participate. So again, it's using that person-centered care to help you understand what is just the enough right support. This might be, again, remember, think back to step 1, which is assess the situation. Sometimes you might need to assess them entirely and say, okay, well, I knew she was more in the early stages of dementia. It's been a couple of months. Let me reassess where their abilities are, because that could help you then determine what that right amount of support is. So it's kind of taking a step back and looking at them holistically and saying, where are they now and what that might look like when it comes to provide the right support. So here are some tips. Again, consider what you know about the person. It never hurts to know them well. And if they tell you if they're nonverbal or if, something may have changed, ask people around them, ask their family, ask their friends, or ask them, directly themselves. Ask them how they'd like to be. This is a big one. Don't assume because you would just like, to get all of the napkins folded. Ask them, okay, I've noticed that you're having some trouble. Do you want to continue doing this? Is it still making you happy, or do we want to do something else? Change how you do activities. Again, a lot of it is about perspective. You may just have to change how the activity looks like in today or in the next few weeks. But yeah, that doesn't mean necessarily if you have to segment more one day that you're going to have to segment more for the rest of, their lives. Everyone has good or bad days, and that's very important to remember when it comes to Alzheimer's or dementia. Start small. Again, the smaller the more bite-sized things can be, the more successful that they can be completing them. Organize the environment. Again, make sure that they're not walking into something that might be a little bit too chaotic for them to understand. Make sure it's organized in a way that they can process. And pay attention to how things are going and make changes when needed. You don't need to wait until a task is completely done to make changes. Sometimes you can tell after the first napkin, this isn't going well. Let's change it and see if that helps. So there's a take-home activity. I'm going to send it over to Amy, and so she can be able to send it out to everyone's emails. It just basically goes into a scenario that you can try with Clara and see, what kind of supports that you might provide them. And then it goes into some of the tips that we just talked about. All right, balancing safety and independence. This is very important because safety should be one of the number one priorities when it comes to somebody. So you will have to know when you might need to step in because their safety might be at risk. So true or false, you only need to worry about safety in the late stage of the disease. Yep, false. Great. It's never too early to create a plan for a person's safety. This can reduce risk and prevent injuries, and it can make everyone feel more relaxed. Again, planning is never a bad thing, because it allows you to think, okay, if this were to happen, what should we do? Staying independent can be very important to people living with dementia. Like we said, no one wants to feel like their independence is getting taken away. But as the disease progresses, you really need to think of balancing safety with independence. Make sure that safety measures are put in before accidents happen. That could look like, one of those necklaces that people can wear when they fall. Again, sometimes people are like, I'm not going to fall. Why do I need that? Just in case. But start kind of implementing those early on because it allows the transition to go a little bit better. But again, it allows you to have the ease of mind or anxiety in case, you're worried that they might fall, but there's something in place. So how does dementia affect safety? Alzheimer's can affect number of changes in the brain. Like we just said, it's affecting the brain cells and the way that your brain is able to maintain memories and thinking and behavior and executive functioning skills. And so this could affect judgment. People can forget how to use appliances. For example, a stove. They can forget to turn things off. And it's not because they're trying to be, unsafe. It's just the dementia's affecting their judgment. Dementia can affect someone's sense of place and time. They can get lost in familiar places and they can wander. About 60% of people with dementia will wander at some point. It can affect behavior. People could get anxious, confused, afraid. They may not trust others. They might become suspicious. Physical ability. Dementia does affect someone's balance. It can affect their ability to stay balanced, to maintain their balance, which can increase their falls. It really can affect someone's depth perception, and so their ability to see contrast, to see, like I said, depth perception, to see how far things away from them, that could be impacted by dementia. And senses. People can experience changes in vision, hearing, sensitivity to temperatures, especially when it comes to, hot or cold, with showers and bathing. And they may have trouble, like I just said, with depth perception or difficulty judging objects around them. Again, that's not because their eyes are going, it's because the connection between the eye and the brain is being affected due to the dementia. Tips to help a person stay safe and independent. Home safety. Keep an eye on garages, workrooms, basements, and outside areas. Make sure that tools, chemicals, cleaning supplies, and other dangerous items are safely secured and potentially locked. You can go to the Alzheimer's Association Home Safety Checklist at alz.org/checklist for more tips. Driving. This is a big one. Someday the person living with dementia will no longer be able to drive safely. Discuss how retirement from driving will be handled before it becomes an issue. It's never too early to bring up some of these topics. You could say, Mom, you're not there yet, but I do want to talk about driving at some point. I've noticed you've been getting lost. Things like that are never they are hard. That's not right word to say, but it's never too early or too late to start having those conversations. And also it allows you to have time to explore other transportation options. Who's going to drive Mom to church every day? Who's going to take Mom to the grocery store? Some things like that can easily be discussed and at least planned before things happen. alz.org/driving can help you learn how to make a plan to stop driving. Firearms and gun safety. As everyone knows, firearms can be very dangerous, especially for someone with dementia, because they might not trust people. They might think that someone walked in and they don't know who they are, even though they do. And so you may want to consider removing guns and other weapons from the home, locking you in a cabinet, or even just removing them entirely. Definitely invite trusted relatives, hunting buddies, authority figures, or other family members to take part in the discussion about firearms. alz.org/safety can help you learn more about firearm safety. And lastly, getting around. So definitely look for places where people may trip or fall in your home or yard. If it's uneven, if there's, an extra step, if there's no railing, but there are steps, things like that are good to just be aware of. Make sure the person takes a fully charged phone or a GPS with them when they go for walks, and then show them how to utilize it if they do get lost. Tell neighbors and people around you that the person is living with dementia because they can help. Definitely keep an extra set of eyes on if a person seems lost, confused, especially if you live in a neighborhood. It doesn't hurt to go around maybe door by door to all your neighbors and just say, I want to let you know, my mom has dementia. If you see her wandering, here's my phone number. Please call me. And enroll the person in medical identification programs. There are a few in Illinois that you can pre-enroll people in. You can put in their information as well as put in your emergency contact information. So if they ever run into a problem with getting lost, that they're already enrolled. So if a police member or somebody, an enforcement try to talk to them, they can find them right away and then find their emergency contact. And then managing your expectations. I know I have 3 minutes left. I'm going to go through this pretty quickly, but really ask yourself what matters. Sometimes you just have to let it go. Again, it doesn't matter if the napkin's not folded properly, if the silverware is in the wrong drawer. What matters is that you're spending quality time together. It's not bad to have a mantra that you can repeat to yourself when you're finding times where, managing expectations can get a little difficult, such as let it go. If it's not done right, then so what? Go with the flow. And with that, that leads us to our resources. I'm going to leave this up if people want to take pictures of it. If you take anything away from today's program, know that we have a 24/7 helpline for caregivers. It is an amazing helpline. I've called it for my family. All you need to do is dial the number. It's free and it's in 200 languages. They can help you with care navigation. They can help you with just being able to unfortunate situations. People call them at 2 a.m. if they have problems. You can call them if you just have a question. They're a great resource. Please save that number in your phone if you are a caregiver. Those are all the websites on the bottom that we talked about with care, safety, and driving. And then there are also some local resources as well. With that, I will invite questions. I know that we are at time, so if you need to head out, that is completely okay. Thank you so much for being here, and thank you for wading through some of the tech issues that I've been having and whatnot. Thank you, Amy, for putting that in the chat. But are there any questions based off the information? If you want, put your email in the chat, and I am happy to reach out to you individually and answer questions or provide you with resources. My email is also in the chat. Awesome.
Thank you,
All right,
Mary.
well, I'm going to stop
That was
sharing.
really wonderful. And again, I think that resource for caregivers, the phone number, make sure you jot it down. And I'll send along the, I think it was some sort of at-home activity. Is that correct?
Yes, I will
I'll
email
send
that to you right now.
Perfect. And I'll
Awesome.
send that to everybody. And then also their website, alz.org, is a very valuable resource. So with that, I
Awesome.
thank you guys so much. And
Thank you.
really appreciate your time. Hope everybody has a wonderful evening.
Bye, everyone.
And I'll take it from there. All right. Bye-bye.